a lot of news. That's where we start about Obamacare, and the news is not so good. But the headline might be Bernie Sanders was right, or Bernie Sanders is right. Remember, Bernie has said forever, look, let's not have a patchwork system. Let's just go all the way, and let's go for single payer and get the insurance companies the hell out of the business. And the latest news about Obamacare, just breaking late last night from the White House, proves that Bernie is right. And it's something I talked about in my book, Buyer's Remorse. This is one place where President Obama really did let progressives down, because there was such a hunger for universal health care in this country. This was the moment when we could do it. Democrats were in charge of the Congress. President Obama had every opportunity. This was the time to get the insurance companies out of the business, to free people from being basically held hostage by the insurance companies, and come up with a plan like Western Europe has, like Canada has, where every American gets health care coverage as a birthright, and it is proven to be the most effective and the most efficient form of health care. But no, we didn't go there. We went into this mess called Obamacare. Now, look, let's face it. Obamacare does have some good parts to it, right? And Bernie Sanders is the first one to admit that. No longer can the insurance companies refuse to cover you because of a pre-existing condition. You can stay on your parents' health care plan until you're 26. No longer can the insurance companies dump you because you got too sick in 1 year and had to spend too much money for doctors or hospitals or whatever. So there's some really good parts to Obamacare, and more people have been able to come in and get health care coverage that they could never afford in their life before. That is good. But the bad parts are, and the risky parts are, again, that you still have to buy insurance from a private insurance company. Every American has to buy insurance from a private insurance company unless you're covered by Medicare. And the other thing is that the pharmaceutical companies, the prescription drugs are still, the government cannot bargain for them. It cannot regulate them, the prices, and so the prices can still soar out of control, and they have. That sets the stage for what was announced last night. The latest news is this, get this, premiums next year for Obamacare are going to skyrocket. They're going to go up an average 25% if you're signed up for the federal program, 22% average if you sign up through one of the state exchanges. And some states, of course, don't have those state exchanges, and that's why people have to use the federal exchange. So either 22 or 25%. Here's what that amounts to. That amounts to $296 a month for they take this for an average 27-year-old single person buying health care in 39 states.
Wow.
How can a single person, 27-year-old, afford $300 a month for health care? I mean, let's assume
What are we doing?
a healthy, right, young man or woman, 27-year-olds, just getting started in the workplace. Maybe, who knows, maybe getting married, maybe starting a family, maybe trying to rent an apartment, maybe trying to even buy a house, and $300 a month for health care? It doesn't fly. It can't work. I mean, but we're stuck. So I wish we could just, again, junk the whole thing and go to a single payer. But at least what we ought to do is what Bernie Sanders has proposed as a temporary fix to Obamacare, and that is adopt a single-payer option and make that part of Obamacare. And remember, and again, I talked about this in my book, Buyer's Remorse. Hate to keep coming back to that, but I talked about it a long time ago, is that with this, the benefit of the public plan option is that would basically enable anybody to buy into Medicare. In fact, instead of calling it a single public plan option, they probably should have called it Medicare for everybody. So you don't have to wait until you're 65 or 70 or whatever to get into Medicare. You could join Medicare, and again, Medicare has proven to be the most efficient, the most effective health care plan that we have in this country, and covers millions and millions of people. So the advantage of this, if you put the single payer, if you put the public plan option in as part of Obamacare, the more people that get into that, the more people that buy into Medicare, the closer we will get to a single payer system in this country, and the sooner we can get the insurance companies out of the way and have a Canadian-like or a Swedish-like or a Finland-like or an UK-like healthcare system where everybody is covered. And by the way, one other thing even that makes this picture even worse, 83 insurance companies are getting out of the business today, which is going to make it worse, because the more insurance companies that leave, the fewer that are left, and the more license they're going to be able to have to raise premiums. So not good news for Obamacare. President Obama insists the plan is still good, the plan is still worth it. Hillary Clinton, of course, has said, well, we're going to fix Obamacare. We're not going to junk it. And you can't junk it without replacing it with something. The votes, I would admit, the votes are not there yet for single payer. But if we can get that public plan option in, I think that's the first step to it. What do you think of this? 866-55-PRESS. The news on Obamacare. Your health care premiums are going to go up an average 25%, 22% if you signed up to a state program in 2017. Isn't it time to admit that Obamacare is flawed and we've got to expand it with a public plan option? Let's talk about it. 866-55-PRESS right here on The Bill Press Show.
It's over for Obamacare.
Follow us on Twitter @BP Show. This is The Bill Press Show.